The way we are treating skin conditions has got to have a shake-up. That is today's show.
Julie, hello, how are you?
I'm doing well. Thank you so much for having me, Alex.
Oh, I am really excited. I literally combed the internet to find who was talking about dermatology in a way that wasn't just let's like burn things off and zap things here and whack a cream on it, because the skin is part of our body, and it just blows my mind that we are where we are with like wait lists for months to get into people who then end up treating the skin as a surface issue. And I came across your work, and I'm thrilled to have you here joining us.
Well, thank you so much. Yes, as we were chatting a little before, there are big problems in conventional dermatology. The system is kind of broken, and I think it's hard on the dermatologists and it's hard on the patients. And like you said, you can wait 3 to 9 months to get in to see a dermatologist, but they all are going to kind of do the same things. So if you have eczema, they're going to hand you steroids to put on your skin or your children's skin, which doesn't fix anything. It just, squashes and pushes down inflammation. Or, if you have acne, they might try to put you on spironolactone or Accutane, and none of these things fix the problem. So it's frustrating.
Really frustrating. And what got you interested? Was it a personal issue that you'd experienced, or patients were coming to you for other naturopathic concerns as a doctor, and then you thought, well, hang on, like their skin is stuffed, and when we fix that, we're seeing this. That's amazing. What was it?
Yeah, so I'm an ND, a naturopathic doctor, and that's different from an MD medical doctor. The MD is kind
Mm.
of a conventional doctor. The ND, the naturopathic doctor, is a more holistic alternative degree. We still have 4 years of medical school, but we get trained in the use of herbs and supplements and diet, nutrition, lifestyle, and we really focus on preventative medicine. And being a naturopathic doctor is the second career for me. So I went to business school and I worked in business, and it was
Mm.
really a passion that drove me to become a naturopathic doctor. And I like to say that the way I got to dermatology was very naturopathic because it was through another problem in the body. And as naturopathic doctors, we always say you have to treat the whole person because all the organ systems are interconnected. So like
Mm.
we're saying, like we can't just take off the skin and make its own separate thing. It's not. It's attached to everything else. So I was diagnosed with Hashimoto's hypothyroidism and autoimmune thyroid disease after I graduated from business school. And when I, went to the doctor, it was my first experience with, a chronic issue and really, being in the medical system for a real problem. And it was so disheartening to hear them say, well, we don't know what causes it. There's nothing we can do to fix it. And you're just going to be on medication the rest of your life. And, you know, the symptoms are going to be there. And that was very depressing. And so I started just trying to do research and thought, like, how can that be the answer? And
Mm.
the more research I did, the more I found out about the things that we put on our skin, just the everyday personal consumer care products, and how much just junk was in them, chemicals, endocrine disruptors. And of course, the thyroid is an endocrine gland. Um, Hormone disruptors, and it was really shocking to me. And so I started trying to make my own skincare, trying to clean things up. And that's really when I fell in love with the skin. So it was my thyroid that got me to my skin in a very naturopathic way.
That was very naturopathic. While I don't love that story for you because you had to go through that, at the same time, it's funny how our mess becomes our message, isn't it?
Absolutely. Yes.
Mm. So we spoke super briefly at the start about the gaps and shortfalls of conventional dermatology. And I love that you mentioned it's unfair for the dermatologists as well, because no health professional signs up to be a health professional to keep people sick. Like that's not the plan. You do it because you want to help people get better.
Yes.
And I'm sure you would have MD friends who you've discussed these issues with over the years. I'd love to see what insights you can give on their frustrations as well.
Yes. Well, for dermatologists and everyone who's at least in the United States, our medical system is, based on health insurance and, then getting prescribed pharmaceutical drugs. And
Mm.
doctors in the United States have to see on average 25 to 40 patients a day. because that gets billed through insurance and that's how they make a living. So 25 to 40 patients a day is expected if you're in the conventional US insurance model, whether you are seeing patients at your own business or whether you're working for an employer. That is a tremendous number of patients. You know, I want all of you who are listening who are not doctors to just think about shaking hands with 40 people a day and saying hello. What if that was all you had to do, is go down a line and say hello, right? You would be exhausted. Now you have to treat 40 people, hear their problems, quickly get them an answer. There is no time. These doctors do not have time. They burn out. Maybe they have 15 minutes max with a patient. And so all they can do is hand these prescriptions. And that's what they've been trained in, is prescribe a pharmaceutical. So all of that education and money that they spend, they're trained on, you know, just writing a script. It's very difficult for them and they do get burned out. I actually have a course called Root Cause Dermatology, and it's a professional course where I teach licensed healthcare professionals how to treat dermatology the way I do. And I have many MD board certified dermatologists who have come through the course, because exactly what you said, they're like, I did not sign up to be handing out tubes of steroids that aren't even working. I'm so burnt out. I don't want to practice anymore. I don't want to be a doctor anymore. And then, you know, I saw this and it's a totally different way to practice medicine. It's completely fulfilling. You aren't seeing patients at this volume. So at least in the United States, our healthcare system is broken between this insurance and pharmaceutical model, and the doctors are caught in between.
Yeah. And I have to say, it's kind of similar in Australia. We're a bit of an America light sometimes when it comes to medicine. And, you know, my own doctor, who's helping me through mold illness by literally just looking at research papers and what people are doing, because the integrative model is also a bit broken in how expensive it can end up privately, right? And so he said, well, let's just figure this out. And we're doing it together. And he said, you know, I don't want to send you to any specialists because I know they will just laugh at you. And so we're just going to have to figure this out. And I just like, we have these conversations and he's like, okay, time's up. I'll do some more research tonight. And I can see him struggling through his model as well, and through how limited the education he received was in terms of going, pardon the pun, but it's a really freaking good pun for this moment, off script.
Yeah. Yeah. And, you know, like you said, you're dealing with mold or mycotoxins. There's a lot of doctors, and I treat mold and mycotoxins within my derm patients, but there's a lot of specialists. But it's like you're saying, if you go through classic insurance and try to get referred to a specialist, they are going to laugh at you. They haven't heard of really mold or mycotoxins, even though it's well established in the literature. There are court cases, at least in America, where you can sue for black mold, like Stachybotrys mold. And we know from farmers that, you know, animals like flocks of birds, or, you know, herds of cattle or goats or sheep die and get very ill from mold and mycotoxin poisoning. So it's a real thing, but it's not at all within the conventional model. You have to go out into more of the functional medicine or naturopathic model. And yes, a lot of times you're going to pay cash, and it certainly can be expensive for the patient.
So for me, one of the best things we can do is actually educate people on how to take steps that they can take and have the power to take every day. And we're going to do that with skin. So there are obviously a ton of skin conditions that would come up on repeat. What would you say rises to the absolute top? I think the eczema, child, whack them on steroids, and basically if you want to keep it at bay, you have to keep on with the steroids. Like, that to me is one of the most broken ones, because it's our children that we see this proliferating in more than any generation before. Can we unpack that one first?
Yeah, let's definitely talk about eczema, and we'll have a lot to talk about, because for all of the chronic derm conditions, the conventional model is let's whack it on the head and knock it down and wait for it to get up again and knock it down again. Certainly 100% with eczema, because the first line thing that you are going to get handed if you go to a dermatologist for eczema, or if you bring your child to a dermatologist for eczema, is steroids, topical steroids. That's the first line that you're going to get. And there's 7 classes of steroids. So class 7 is the weakest steroid, that's hydrocortisone. And you can get some hydrocortisone like over the counter from the drugstore, at least in the US. And then you start going up to stronger topical steroids. They need prescriptions until you get all the way up to class 1 super potent steroid, something like clobetasol. That's 600 times the strength of hydrocortisone.
Whoa.
Yeah,
And so do you end up kind of progressing through these levels
we
because
call it
they
the
stop
ladder, the
working?
steroid ladder. Yeah, because it stops when you're putting it on, you're putting on more and more, it stops working. So they're going to step you up to the next class of steroids, and then that will stop working and you go up and up. And what's interesting is for these really potent steroids from like class 4 to class 1, when they first came out, there was all these warnings: do not use for more than 2 weeks. Do not use this one on the face. Do not use this one on children. I mean, there was all of these, very stern warnings about how to properly use the steroids. And it's really been thrown out the window because there haven't been good options for squashing the inflammation with eczema. And so it's like we said, they have to go to stronger and stronger steroids. And so they started using them on younger and younger patients and all over. And there's kind of no rules now. I mean, I have patients who have been using topical steroids for like 20 years. And now there's other topicals that you'll be offered by a dermatologist where they'll say it's not a steroid. And that is technically true. So something like tacrolimus, which is a calcineurin inhibitor or protopic, or something like Eucrisa is a PDE4 inhibitor. They are not steroids, but what you heard in both of those drug classes is inhibitor. So it's a similar thing. It's just squashing down inflammation. They don't try to get at the root cause of it. And now the problem is that they've come out with these injectable biologics. So dupilumab is the generic name and Dupixent is the brand name. And that's an injectable biologic that quashes the immune system. So now we've gone from just putting things on topically, we're going to inject it, we're going to push down the entire immune system. And this drug is, in the United States at least, I don't know about Australia, but in the US, it started off approved for adults and then they kept going lower and lower. It's now approved in infants 6 months old.
Oh gosh.
Yes.
And can you talk us through some of the negative long-term impacts some of these drugs can have, just so we connect to a why on like fixing this problem?
Yeah, so with topical steroids, there are known problems like thinning of the skin. You can get scarring. It stops working. And then worst case scenario is something called topical steroid withdrawal syndrome, where when people have used it for a considerable amount of time, especially with those stronger ones, and then they suddenly stop using it, the adrenal gland kind of gets messed up because the adrenal gland produces cortisol. And there's just a whole problem that happens where the system gets confused. And with oral steroids, so if you take like an oral prednisone for long enough, the doctor must taper you down because it's understood that it's life-threatening if you don't. But for some reason with topical steroids, there's been this complete resistance to admit that we're absorbing enough of it to kind of cause a similar thing. Now, the good news is, again, I apologize, but I only know for the US, the National Eczema Society has recognized topical steroid withdrawal. It's on their website. In the US, our insurance billing codes are what are used to diagnose things. And we should be getting an ICD insurance code for TSW within the next year or two, which then will allow for insurance and coverage and research. So topical steroid withdrawal is certainly the worst part of using like long-term topical steroids. Dupixent, the injectable biologic, you have a different problem. So anytime you talk about injectable biologics, our immune systems have lots of different ways that they can fight. And I talk to my patients, I say it's like our armed forces. We have Air Force in case the threat comes by air. We have a Navy in case the threat comes by sea, and we have an Army in case the threat comes by land. We need to be able to respond in different ways to different threats. So does our immune system. There are biologics for different diseases, but in the case of eczema, dupilumab, it's a Th2 pathway, which is our allergic pathway inhibitor. So it's going to inhibit the ability to respond to certain types of events that the body sees. We know that there's a big issue with conjunctivitis, so eyeball inflammation with it, but there's other problems like fungal infections that are coming up.
I was going to say,
Yeah, I mean, you're
yeah,
suppressing an entire path of the immune system. You're going to have more susceptibility to certain infections and other issues. So, and all it is a suppressive. So the minute you
yeah.
go off it, you haven't solved the problem. You can't go off it.
Not
That's
to
the
mention, fungal infections can then exacerbate or bring up eczema,
Yeah, there's
ironically.
something called dupilumab dermatitis, which is people were getting these like red rashes all over their face and neck. And it was due to this fungal organism, Malassezia yeast, which is on all of us.
Oy.
Couldn't fight it because they were on dupilumab. And similar things happen. You know, we haven't talked about psoriasis yet, but there's a whole boatload of biologic injectables for psoriasis. And, you know, it's the same thing. It's just inhibiting different part of the immune system, the Th17 ability to respond to like bacteria and fungi. So it's the focus on pharmaceuticals, the focus on suppressing symptoms is where we are going wrong in conventional medicine. And I think we've kind of lost our sanity about it. Like it doesn't make sense. We think we're so fancy with all this research and medication, but like let's just take a step back. Why are we suppressing it? Why aren't we trying to fix it? The body should not be having eczema. The body should not be having psoriasis. We should not even be having acne. Why are these things happening? And that's what naturopathic medicine does is we're like 2-year-olds. Why, right? We want to keep
Yeah.
pounding the whys until we get to that answer and say, okay, now I get it. Now I know what I can do to fix this. And that way I don't have to suppress it. We're going to fix it.
Very broken indeed. And so you've mentioned there eczema, psoriasis, and dermatitis. And these guys often get grouped together in 3 when they get mentioned, but they're obviously different. Is it dependent on the bio-individual as to which one you get and root causes that then push out a certain result? Or are they just separate and they happen for separate reasons?
Yeah, the first thing is dermatitis is just skin inflammation. So it's
Okay.
not telling us why. Usually we're putting that in the same bucket as eczema, which is atopic dermatitis or allergic dermatitis. But just to be technical, there's, you know, lots of different types of dermatitis. But if we look at eczema and psoriasis, I would say that there's similarities in terms of what drives it and then differences. The similarities, my approach is I like to see what is going on in the gut microbiome.
Mm-hmm.
And I think at this point, people have heard of the gut microbiome, but if you're not
Yeah.
sure what it is exactly, it's in adult patients, it's about 3 to 5 pounds of microbes. So trillions of microbes that are living in your gut rent-free, and we feed them for free. And the reason we have these microbes is that we've co-evolved together. We cannot exist without them, and they can't exist without us. So we are living this commensal life together. And it's a lot of bacteria, but it's also fungal organisms, things called archaea. We can have protozoa, viruses, worms, all sorts of things in there. We need a microbiome. We need a gut microbiome. That's essential. But a lot of our Western lifestyle causes dysbiosis or dysfunction in our gut microbiome, where we don't have enough or even the presence of the good guys that we want, and we have too much or, you know, way overgrowth of the bad guys. And that's where I start, is by testing and fixing the gut microbiome. So every patient who walks through my door has to do a stool test and a urine test called an OAT. And the reason I'm having them do these is that this will show me what are the microorganisms living in their gut and in which amounts, and what do I need to do to fix things. Because our immune system is really driven by our gut microbiome. The good guys are there to keep a healthy and calm immune system, and things go awry when we have things like leaky gut or overgrowth of unwanted organisms. So for me, like all of the derm dysfunction, whether it's eczema, psoriasis, rosacea, alopecia areata, acne, whatever, it's all going to start with the gut microbiome and me doing these 2 foundational tests to see what's going on. Now, that being said, you know, I tend to see different patterns. So in eczema, I tend to see a certain pattern of stuff going wrong that's very different, for example, from my acne patients.
Right.
So, you know, I would say that sometimes there's similarities, but there's definitely differences between all the diseases, what's happening on the skin microbiome, and also what's driving the bus, so to speak. Like, is it more of an Army problem or a Navy problem, to go back to that example we talked about before.
Yeah, practical analogies, love it. And so you mentioned patterns. Can we get a bit nerdy and talk about some of the patterns you do see on both an oat, which for people who might not know, that one is an organic acid test, a urine metabolite test, and the stool test. And because I know everyone's going to be like, what type of stool test, Alex? She didn't mention it. I'm asking you now just to have the preferred one that you use in the States, because we often actually, believe it or not, as Australians, ship our poop to the States to get analyzed and our urine, because we don't have labs big enough here to do it yet.
Yeah, so my favorite stool test is the GI map by Diagnostic Solutions Labs. And do they have an affiliate in Australia?
We do. We have TheraHealth. So you can definitely go through your naturopath or nutritionist locally to get that here. But we have lots of American listeners who are going to be able to ask for that too.
Yes, yes. And I know that the GI map has distributors throughout the world. So wherever you are, you can check and see if your functional medicine doctor, can get them. But that's the stool test I use. And okay, so the patterns, yeah. So with eczema, I see a leaky gut. And let's go back. And again, I think this is a term that a lot of people have heard of. And then if you say, do you know what it is? Or like, maybe if you explained it to me. So our gut, most people are surprised to hear, we have a lot of mucus production in the gut. It's a thick mucosal layer that acts as a barrier. And why do we need a barrier? Well, let's kind of think through the biology of this, the chemistry. We eat and we poop, right? So that's the beginning of the digestive tract, the end of the digestive tract. What's happening in between? We are digesting the food and extracting nutrients, and then we're getting rid of the waste. So we've got all these nutrients in the stomach and in the intestines. Do we want it to stay there? Do we just want all the nutrients living in our intestines? No, of course the answer
No, thank you.
Every cell of our body needs these nutrients. That's why we're eating. The hair on your head needs nutrients, your pinky toenail, your brain, your heart, your liver, everything. So how do we get the nutrients to every cell? The bloodstream is the superhighway of the body. And so we absorb the nutrients through our gut into our bloodstream. So we need a semi-permeable gut in order to absorb nutrients and stay alive. But we don't want everything getting into the bloodstream from our gut. We don't want all that bacteria and, the 3 to 5 pounds of microbes living in the gut. They belong in the gut, not getting in the bloodstream, or undigested food or things like that. And so that mucosal barrier I was talking about is really the guardian. It's like the bouncer at the door saying, oh, you're, a carb, come on through. Your glucose, here we go. Your vitamin A, yes, walk on through. And then when it sees a bad guy, like, oh, wait, you're a microbe. No, we don't want you in the bloodstream. You're not fully digested food. Nope, stay out here. We want this kind of process where certain things get through, but other things do not. And that thick mucosal surface navigates this for us naturally. And some of the good microbes in our gut are there to help keep this mucosal barrier healthy. In a leaky gut, that mucosal surface is degraded and we have kind of entry into the bloodstream to unwanted organisms. And so that leaky gut picture is definitely what I see on in my eczema patients. And I see that in the form of, there's 2 commensal bacteria that help maintain the gut microbiome. One is Akkermansia muciniphila, and another is Faecalibacterium presnitzii. And those are either low on the GI map or they are below detectable limits, meaning not found. Then secretory IgA is another marker I use for leaky gut. That is secretory immunoglobulins. It's the immune system of the gut, and it comes from that mucosal surface. If that's really low, that's also an indicator that that mucosal barrier is really degraded and low as well. Now there's other markers. You can order a zonulin and other things. It's not like one marker for leaky gut, but the pattern I tend to see is low or no Akkermansia, low or no Faecalibacterium presnitzii, and a low secretory IgA. So I see that on eczema. And then I see overgrowth of Staphylococcus and Streptococcus bacterium and Candida yeast. So that's kind of the eczema gut.
And Akkermansia is kind of one of those new buzz strains that a lot of people are talking about. The supplements for that strain tend to be quite expensive. Are they effective in your clinical practice? Have you seen people being put on them and it really helping things?
Yeah, I do use the Akkermansia probiotic. I use the one by Pendulum. I think there's two elements to probiotics. One, you know, is it going to repopulate the gut? We know that they don't kind of work that way. It's more the postbiotic effects, like what those microbes have made and what's in it. So, my plans are complex. I haven't just ever tried a just Akkermansia plan.
Yeah, yeah.
But I do use it in my plans. I just think even if it's not repopulating the Akkermansia on its own, that the postbiotics from that missing Akkermansia could be helpful.
Yeah, really valid point. And in terms of the leaky gut and the things you see that tend to correlate with your eczema patients, why do some people have a leaky gut and not get eczema? Like what is there something extra that's happening that would then cause it to present on the skin for certain people?
Yeah, you're right. So just because you have a leaky gut absolutely does not mean that you have you have eczema. But part of it is genetics. So we know that people with eczema or psoriasis or alopecia areata, there does tend to be a family history. So there's certain genes that might kind of predispose you to it. There's a protein that we make in the skin called filaggrin, and filaggrin goes on to make something called natural moisturizing factor. NMF. Natural moisturizing factor protects the skin from overgrowth of something like Staph aureus. A lot of people who are predisposed to eczema have filaggrin gene mutations, especially people who had it as infants. So they don't produce as much filaggrin as like kind of, typical genetics, typical people do. So they're going to be predisposed to it. And then when they get the leaky gut, kind of everything goes off. So, I think there's a lot of reasons, but there's certainly a family history and a genetic component to, is this problem going to lead you off to develop eczema or more of a psoriasis picture?
And then, so how is psoriasis different? Let's talk about that.
Yeah. So eczema, we talked briefly before, is this Th2 pathway. And the Th2 pathway is an allergic response. So when the body sees an allergen, it's going to go for Th2, and everyone with eczema has got a lot of Th2 response. The Th just stands for T helper cells. So it's a type of immune cell. Traditionally, we thought of eczema just as a Th2. As it turns out, there's other responses that can be happening like Th1 and Th17, but it's always and predominantly this Th2 response. Psoriasis is heavily a Th17 response, which is that's not the allergic one. We don't see Th2 in psoriasis, we see Th17. Why are T helper cell 17 upregulated? We tend to see bacterial and fungal at mucocutaneous sites. So things like the respiratory tract, the gut, the skin. And for psoriasis, the number one most known environmental trigger is getting strep throat. And so that's a bacteria at a mucocutaneous site that's going to set this Th17 path off. That's not the only one, but it could be gut dysfunction and other things. Psoriasis is Th17 and Th1. So predominantly Th17 with kind of a secondary Th1. So it's different immune responses to different problems. Again, it's, Navy, Army, Air Force. Where is the problem coming from? You're going to have a different response. And with eczema, we typically see patches on what we call the flexural surfaces. So the inside of the elbow, behind the knees, where the limbs will fold up. It's that pocket area inside the elbows, behind the knees. Psoriasis tends to be these scaly plaques on the extensor surfaces. So on the outside of the elbow, on the top of the knees, when you extend the limb onto that outer joint, that's where we see psoriasis. Those aren't the only places, but that's kind of the typical, spots for where you're looking for things.
Yeah. And so in terms of root cause and root cure, like obviously we don't want to make people feel bad who might be on conventional treatments right now, but my hope is that we start to realize that while they may provide a function in an SOS context, because people have to live, and of course we don't want people hurting and burning and not being able to show up to work. Totally get that. We also want to really step through some of the ways that we can start having more empowered conversations, or at least starting to seek out health professionals in our own lives that want to have those conversations about the long game, right?
Yes, and 100%, a lot of my patients come to me already on some of these injectable biologics or whatever. They were suffering so badly and they
Mhm.
just needed something to allow them to live day
Yeah.
to day function. And I think when you look at conventional medicine and pharmaceuticals, that's where it shines, right? It's amazingly powerful that we can use that for short periods of time to control symptoms while we're trying to figure out what's going on. People should not needlessly suffer, and levels of anxiety, depression, and even suicidal ideation are increased in people with these derm conditions. These are not vanity issues. These are
Mm.
systemic inflammatory conditions that can be really life-changing and debilitating. So 100%. If somebody needs these medications, I think they should go on it. And please, for anyone who's listening, do not stop your medications without talking to your healthcare provider. It can be dangerous to just stop them. So you always want to work with your prescribing physician, on any changes in medication.
Mm.
But the way I use it is like, if, usually patients are coming to see me because they're on these drugs, but they want to get off it. They want to be able to find the root cause and treat it and get back to a healthy place with their body and their life. And so that's what we do, investigating what's driving this process for them while they are on the medication to kind of control the symptoms and allow them to live.
Mm. And when we start with gut health, that's one of those really interesting things for me, because obviously we hear a lot. I've had Kieran on the show a couple of times, and we've talked about the importance of eating the rainbow and quality protein and starting to up your fiber. But if we up the fiber in a sick patient, that can sometimes really backfire. And so eating healthy to repair the gut often comes in stages as well. Can we just speak to food for a little minute, and how you would often find yourself guiding people in that area?
I focus on many of the same things, eating the rainbow. And for my adult patients, I do like them to work up to 35 grams of fiber a day and 30
Mm.
different plants a week. So we're looking at quantity and diversity. But the first thing we do before anything is I have them track their meals, their diet for about 3 or 4 days so that we can see right now how much fiber are they averaging.
Yeah.
Because while the goal is 35, let's say they're at 15, we can't just flip a switch and go to 35 because it will be very hard on their system. They can get constipated, they can get a lot of gas and bloating and burping and really uncomfortable. So we have to slowly work up the fiber. And, say we're not in a race. And so I like to do that with about one serving, increasing a serving of vegetables a week and just allowing their system to kind of adjust to that.
Go really gradual. Yeah.
Yeah.
And then in terms of herbal medicine, there's obviously some really beautiful herbs that can be used to start supporting both the gut and the skin. What are some of your favorites?
Yeah, so those are my workhorses. My heavy lifters are my herbs. And, as a naturopathic doctor, we're trained for 4 years in herbs. I'm also a registered herbalist through the American Herbalist Guild. So they're what I use. And there's so many beautiful herbs. I mean, I love neem, oregano,
Mm.
garlic, berberine, uva ursi, caprylic acid, grapefruit seed extract. I mean, there's just some great herbs out there. I like to use formulas. So I use a lot of like combinations, and I switch up the herbal protocols about every 2.5 months.
Oh, and why would that be? Is that because bodies, again, get used to different herbs?
Yeah, I mean, certain herbs, even in combinations, are better at attacking different organisms. There may be an unwanted impact on some commensal organisms that we can't necessarily control for. So after a patient has been on it for about 2.5 months, we switch them up and just make sure that we're not kind of hitting the same organism, over and over without making changes over time. It's not like antibiotics where you're going to get resistance.
Mm.
Antibiotics are one chemical, and it's much easier for microbes to get resistant to that one chemical. But even the blends of herbs do a better job on certain organisms than others. So you have resistance in that way.
Got it. And in terms of our kids, obviously we're seeing a generation with skin issues greater than ever before. What are some of the key things that you think women could even be doing in pregnancy to, like, is there any research starting to show that what we could be doing in the preconception and pregnancy phases start breaking this crazy pattern we've seen of proliferating skin issues?
Yeah, there's a couple things. I mean, if at all possible, avoiding antibiotics while pregnant, or, early antibiotics early in an infant's life. Um, it really just destroys the gut microbiome. And so you get this short-term benefit, but long-term it can cause damage. I have a lot of patients where I've been treating an infant with eczema and or a toddler, and then the mom is thinking about getting pregnant again. And so there's a lot of those moms where I'm treating their gut microbiome. They don't have skin issues necessarily per se, but the baby was born with such gut microbiome dysfunction that we fix the moms before she goes to get pregnant again. And of course, nothing is, a guarantee, nothing is 100%, but having mom have a good, healthy gut microbiome to support a developing new life, because mom is the donor of her gut microbiome to the baby, I think is really helpful.
Yeah, absolutely. I remember my naturopath putting me on a very comprehensive program during pregnancy to get that piece right. Sadly, I was also part of a generation where if you had that, I think it was strep B positive test,
Yeah, they just gave you
probably they gave
antibiotics.
me antibiotics at birth, like
Right.
during the labor, and we all wish we could turn back time sometimes when we learn new
Yeah.
stuff. But I am of the opinion that we get excited about what we know now and we can do now, rather than things we didn't know and operating in regret.
Yes.
In wanting to help people not regret things like that, because so many women have thought, oh God, I've got to do the best for my baby. And then you're in the fear, like, we can actually improve gut function and therefore skin resilience at any age and stage, right?
Any age. Yes.
So
Yeah.
good. Now, I want to talk lastly about sunspots and skin cancer, a controversial topic, which I don't think it needs to be. I think we should all be on team, let's reduce skin cancer.
Right.
I don't know why that's controversial to then actually have a debate about how best to do that, but it is. So something so many people go to the dermatologist for is zapping and cutting off of little bits and pieces of their faces because they're pre-cancerous, and I'm certainly not disagreeing with any doctors doing any of that, by the way. But what is your take on how much skin cancer is proliferating and how it correlates with us staying out of the sun and with more sunblock than we've ever used before?
Yeah. So let me just say, I'm a naturopathic doctor who specializes in dermatology. I'm not a dermatologist. Treating skin cancer is not within my scope of practice. So I'm not taking care of skin cancer patients, but I have a lot of patients who have skin damage or, history of things, and there's things that we can do.
Yeah.
I I think that the problem we have is that we have become sun phobic. And so most dermatologists are going to tell people to stay out of the sun. But there are very good studies, large studies on large cohorts of people who completely avoid the sun. And we know that people who completely avoid the sun are sicker and die, younger than people who go in the sun. Like, we are not vampires. We're not nocturnal. We're diurnal creatures. We were meant to be up with the sun, out in the sun all day, and then go back to the cave and go to sleep at night. So first of all, I think we actually have too little sun exposure. I think we see that in low vitamin D levels. And the problem is, the easy thing is like, well, let's just supplement everybody with vitamin D and get their blood vitamin D up. We can do that. But unfortunately, the research doesn't show that jacking up blood levels of vitamin D, it's not actually really helpful. Like, there was just a whole new meta-analysis for eczema or atopic dermatitis that they pumped people full of vitamin D that had low vitamin D, and their eczema didn't get better. Why? Because vitamin D is really a proxy for sun exposure. There's a lot more benefits we get from the sun than just vitamin D. And by just giving somebody a vitamin D pill, we don't get those benefits. So I think we need to be getting more sun. I actually counsel my patients, to try to get, at least 15 minutes a day. I think avoiding the face and the back of the hands exposure is a good idea because there is aging from UV radiation and we don't need to get it from the face. So body parts is actually a better way to get vitamin D production. But we need the sun for so many reasons. And, it's just like a plant would wither and die if it never had sun. Well, it's part of our, healthy lifestyle, just like water and sleep. We need sun. Now, that being said, we know that there's skin cancer and there's different types of skin cancer. So there's basal cell and squamous cell carcinoma are the non-melanoma skin cancers, and they're actually the most common. Now, the good news is they're not deadly usually, like you'll see it and be able to get it far in advance. And that does pretty directly correlate with UV exposure, but there's things that we can be doing to limit the UV damage. The foods that we eat provide internal sunscreen, right? We're not vampires. The minute a ray of sun hits us, we don't start burning and disappearing. We all, no matter what your ethnicity is, there's some amount of time you can be in the sun without burning. And that's that internal UV, protection. There are studies that eating foods high in lycopene and green tea and other polyphenols actually allow you to be in the sun longer without burning. So it increases your internal UV protection. We're not eating those foods like we used to, so we don't have it as much, but you can eat your way to some amount of sun protection. Of course, you can use, natural physical sunscreens with the zinc oxide. You can cover yourself up, but there's healthy ways to get sun exposure. And there are some supplements that can help with people with squamous cell and basal cell carcinoma. Niacinamide is a derivative of vitamin B3. And there was a good on-track study that showed that people who previously had basal cell and squamous cell carcinomas, if they supplemented with 500 milligrams of niacinamide twice a day, it reduced the risk of getting additional those types of non-melanoma skin cancers up to a third. But
Wow.
niacinamide is a water-soluble vitamin, so you have to keep taking it or try to eat foods high in niacinamide. Now there's melanoma, right? Melanoma is the scary skin cancer because that's the killer. But the trouble with melanoma is we get melanoma in places where the sun don't shine. So that's where I recommend to patients, you should have a dermatologist. You should go in and get a full body mole mapping from that dermatologist every year. They are going to look in all the nooks and crannies and places where you can't see and even your partner might not be looking, to make sure that there's not a melanoma hiding, because that will kill you, and that can kill pretty quickly because it metastasizes, and then it's a deadly form of skin cancer. But that that correlation exactly with sun, that's where the research starts to falter a little bit, because why are you getting the melanoma in between your butt cheeks that really doesn't get sun exposure? So I think there's more to the melanoma skin cancer and sun discussion. There's still research to be had. The basal cell and squamous cell, it does seem to be pretty tightly correlated with UV exposure. And so, for example, bald men, the tops of their heads will often get, the face, the ears, the nose, the stuff that's always out in the sun. Those are the more prone places to get that type of cancer.
Yeah, and we've got such good apps now to, like in Australia, I mean, the sun is so harsh compared to in Europe, where my mum's side of the family's from, and you really feel it. So, but you can be guided by an app really easily on when to stay covered up, or use a bit of zinc oxide based natural sunscreen, and when you should be also going out and getting your sun exposure.
Yeah. Yeah, we all mostly need more sun exposure rather than less. So we have to do it in a responsible way. You never want to burn. If the skin gets lightly pink, but when you're back inside for about 15 minutes, that should disappear. That's all healthy sun exposure.
Yeah, and I feel like we actually just need to get used to the phrase healthy sun exposure in itself, because we've been so terrified of sun exposure growing up and with the ads, and clearly it's not working because we're just getting more skin cancer than ever before. So
no, and it
time to
doesn't even
change
make
tack.
sense when you think about it. Otherwise, we would be nocturnal creatures. We're not. So.
So many things more I could ask you, Julie, but I will ask you this to finish. To help people like almost audition decent practitioners that are going to have root cause conversations about skin issues they've had or their kids have had, what could you offer as helpful tips? I mean, in a perfect world, we're all able to just come and see you over in the States. But I think a lot of people struggle to know what questions to ask, to know they're on the right track, finding the right kind of practitioner to help them.
Yeah, I think that's very important because a lot of people say they treat derm, for example, but what are they doing? You know, do they specialize? What's the approach? So I am licensed in California, Oregon, and Washington. So anybody who is listening to that, who's a full-time resident of one of those 3 US states, you know, they can go to my website, integrativedermatologycenter.com. And I'm not always open to accepting new patients because I get too full, but if I'm open, you'll see that. But there's a real lack of qualified healthcare practitioners out there. So I started a course called the Root Cause Dermatology course for professionals.
Yes, I saw that and I love
Yes.
this. So good.
And so I'm training other healthcare professionals, like I mentioned, even board certified dermatologists, other naturopathic doctors, functional medicine MDs, DOs, nurse practitioners, physician assistants, registered dietitians, a lot of different degrees. I train them in my methods, and there's a practitioner database. So you can go to rootcausedermatology.com, and then at the top, they'll find a link that says find a practitioner. And it's more US based, although there's more and more international providers coming out. But as they graduate and complete and pass the course, they get listed in that database. If there's nobody in there and you're still looking for somebody, I mean, I would interview them. I offer, for example, a free 15-minute consult. I think most naturopathic or functional medicine doctors offer some sort of a free consult. And I like to do it to make sure it's a good fit. Do I treat the condition that this person has? Do I feel confident in it? And, you know, am I a right fit for them? So I think that's important. So hopefully they have something where you can chat with them and ask them their approach. I think too many functional medicine and naturopathic doctors, when it comes to skin, they've just focused on elimination food diets, which, you know, on some level might be helpful, but that's just a small piece of the puzzle. So if all they're talking about is eliminating foods, you know, maybe keep looking.
Going down the intolerance road and that's it.
Yeah, because then you end up on a diet with like 3 things and you still have an issue, and it's not usually the way to get to the root cause. You know, if they're talking about the gut microbiome, you know, if they're talking about things that resonate with you, then I think you can feel a little more secure that they're going to be more experienced in it. And ask them, you know, do they specialize in it? How long have they been doing it? You know, those kinds of questions. But, you know, I would want to hear that practitioner is looking at the gut microbiome.
Yeah, so good. Thank you so much for taking the time to share with us, Julie. I really appreciate it. And I love to know that there is holistic dermatology happening in the world now. It's the 2.0 the skin needed. So thank you so much for joining us.
Thanks so much for having me.